So I'm going to talk about surveillance and screening for new cancers in adult survivors of childhood cancer. Just to put our study into context, as you heard a few moments ago, there are over 325,000 survivors of childhood cancer alive in the United States, and of those we expect that about 9% will develop another new cancer within 30 years of their original diagnosis. They are 15 times more likely to die of another new cancer than the general population, and as a result there's broad consensus that survivors of childhood cancer need regular surveillance and screening in the hope that if we pick up these cancers early, we can change the mortality associated with them. So just to give you a little bit of background on the Childhood Cancer Survivor Study, and the next presenter will be presenting data from the study as well. The CCSS is a 26-center study of survivors of childhood cancer who were diagnosed between 1970 and 1986. There were 26 institutions, one in Canada and 25 in the United States. And on one of our questionnaires, we asked 8,318 survivors about their cancer screening practices. The average age at the time of their initial cancer diagnosis was 8, and at the time of our study, they were 31 years of age on average. And we asked them questions about whether they'd had mammography, colonoscopy, pap smears, and complete skin exams. And in addition, we compared their results to data from the general population that we obtained from the National Health Interview Survey. We divided our study into two separate parts. So I'll just move on through there. In the first part, we looked at survivors at high risk of getting another cancer because of their previous treatment. So we know that survivors who have radiation for their initial cancer that involves the bowel, the colon, are at increased risk of colorectal cancer. And for that group, there are recommendations from the Children's Oncology Group for colonoscopies to take place every 5 years starting at age 35. And in our group, only 12% were compliant with this recommendation. The second recommendation is in females at increased risk of breast cancer. So these would be females who, during childhood, had radiation to the chest that involved the developing breast. And for this group, we know that they should start getting screening at age 25, or 8 years after their initial cancer, with annual mammography. And unfortunately, only 46% of our survivors actually complied with this guideline. And finally, we know that the rates of non-melanoma skin cancer in radiated areas are approaching about 7% in survivors by about 30 years. And so there's a recommendation that every survivor who's had radiation should have an annual skin exam that looks at all radiated areas, so once a year, and only 27% of our survivors are compliant with this recommendation. So overall, very poor compliance in all three categories. The second part of the study is separate. Here we looked at those survivors who we did not think were at a particularly increased risk of getting another cancer and compared them to the general population in terms of whether they followed the screening guidelines that have been published for the general population. And we used the guidelines from the United States Preventive Services Task Force, which, for example, suggests mammograms in women over 40 every 1 to 2 years. And what we noticed is, at least in compliance with those guidelines, our survivors did better than the general population. So 67% of survivors were compliant with those mammography guidelines versus only 58% of the general population. We looked at colonoscopy screening between age 50 and 70 to look for colorectal cancer, and found that only a quarter of our survivors had actually had a colonoscopy in the recommended period, and the general population did equally poorly. And finally, we were interested in cervical cancer, for which there's a recommendation for pap smears every 3 years starting at age 21. And once again, our survivors did fairly well, 82% of them being compliant with those guidelines versus 70% in the general population. So in conclusion, the rates of colonoscopy, mammography, and skin exams in survivors who we know to be at high risk of getting another cancer were very low. Care at a cancer center was one of the factors that actually predicted increased surveillance for skin cancer and breast cancer. Unfortunately, only 12% of our survivors have regular care in a cancer center, the majority of the rest of them getting their care from their family practitioner in their own communities. Non-high-risk cancer survivors were more likely to have mammograms or pap smears than the general population, but adherence rates were very low for colonoscopy and only moderate for mammography. And so we concluded that survivors and their physicians need to be educated about the need for regular screening and surveillance, and most importantly, survivors need to know what therapies they received and what long-term follow-up they require, because at the end of the day, they are the best advocates for them getting regular screening and surveillance. Thank you.
Thanks, Paul. I just want to make a couple comments about this study. It shows us that childhood cancer survivors are perhaps unaware of the risk of their treatments. And when they transition into their primary care physician's office, our physicians as well are unaware of the risks of secondary malignancies. It is imperative that we support cancer survivorship programs and that we include specific screening recommendations for these patients so that detection can occur early and we can prevent secondary malignancies.